I wanted to note our schedule for this week. Dr. Henry and I will provide a briefing here in Victoria tomorrow at 3 o'clock. On Wednesday, we'll be providing a written briefing also at 3 o'clock. On Thursday, there'll be a briefing at 3 o'clock, and at that time, Dr. Henry will be presenting some updates to our modeling and some information about some analysis of the COVID-19 in British Columbia that will be interesting and new to people, so you can look forward to that on Thursday. I want to acknowledge that we're on the territory of Lekwungen-speaking people of the Songhees and Esquimalt First Nations, and it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So today, June 1st, we're updating on the 2 reporting periods from our last meeting, which is Saturday to Sunday. And between that period of time, we had 9 new people who tested positive for COVID-19. And then again, from Sunday to this morning, there were an additional 15 cases who tested positive for COVID-19. So that's 24 new test positive cases in the last 2 days, bringing our total to 2,597 people in British Columbia. And that includes 904 in the Vancouver Coastal Health Region, 1,307 people in the Fraser Health Region, 127 in the Vancouver Island Health Region, 195 people in Interior Health Region, and 64 people in the Northern Health Region. This does tell us that there is still transmission of COVID in some of our communities around the province, and that we're not completely out of the woods yet. On another positive note, though, we've had no new healthcare outbreaks, and one has been declared over, and that's the outbreak at the residence at Clayton Heights. We have, therefore, 13 active outbreaks in our healthcare system, 12 in long-term care and assisted living, 1 remaining one in acute care, and we now have 556 cases associated with our healthcare facility outbreaks, and that's an additional 1 resident and 1 staff person. There are no new community outbreaks today, though obviously with the new cases, there's ongoing investigations. So that leaves us with 224 active cases as of this morning, of those of whom 32 people are hospitalized and 5 people are in critical care or ICU. We have had 1 additional death in the last 2 days in a long-term care home in Fraser Health. And our condolences go to the family and the care providers in the community of their loved one. 2,207 people have now fully recovered, so that's 85% of our cases who have tested positive in BC. As you know, the province-wide survey that we had, Your Story, Our Future, closed last evening at midnight, and 356,196 people in British Columbia completed the survey. So thank you to everybody who did that. This is important and valuable feedback that will help us understand the impacts that the restrictions and the pandemic and COVID have had on our communities across this province, and will help shape our reaction and our responses going forward. So as we know, there's a number of things that are happening in our communities around the world, in the United States and here in British Columbia over the past few days. And our Lieutenant Governor, the Honourable Janet Austin, has asked British Columbians to pledge to uphold the values of diversity, inclusivity and respect, and to oppose racism and hate in all forms. And I am honoured to join our Lieutenant Governor in making this pledge, and I encourage all British Columbians to do the same, and Minister Dix and I have pledged to do it together. So this Together pledge is our BC is inclusive and respects people of all ethnicities, cultures and faiths, and their contributions to our collective well-being. Our BC holds diversity as a fundamental value at the heart of the success, strength, and resilience of our communities, workplaces, schools, public and private institutions. I pledge to uphold and promote these values, and I commit to speaking up to oppose racism and hate in all its forms. Hate has no place in our province, and we have said that many times through this pandemic. And throughout this pandemic, we must continue to show the kindness and compassion that brings us together as a community. We know that British Columbians have been speaking up against racism, and I want to say I'm very pleased that this was done peacefully in British Columbia. Like all Canadians, I strongly believe in the importance of upholding our shared values of inclusion and tolerance and respect. Peaceful demonstration is our right, one that is important to all of us, but we cannot forget that we are still in the middle of a pandemic that is affecting our communities and our loved ones. Taking care of ourselves and each other is our responsibility, particularly to communities that are at greater risk of having devastating impacts of this pandemic. And we know that includes racialized communities. We know that includes our Indigenous communities. So out of respect for them, we must be careful in how we exercise our right to peaceful demonstration. I saw many people wearing masks and keeping their safe distances yesterday, and for that, I thank you. And I encourage anyone who may be demonstrating to also please continue to keep that safe distance, to recognize the importance of making sure that we are not allowing this virus a chance to spread. Weigh your options. Think about the impacts, particularly if you are a healthcare worker or have vulnerable people in your circle, in your household, in your family. We have seen many people around the world demonstrating at a distance, and it is very impactful and it is effective. Your message can still be heard clearly, no matter how far apart you stand. We know that that's a message of solidarity, not only for our fight against racism, but in our collective actions to prevent this pandemic from worsening. We also know that right now large gatherings remain very high risk, even outdoors. Those who were there yesterday, you may have put yourself at risk, and you may bring that back to your home. So you need to monitor yourself carefully over the next coming days to 2 weeks. And if you have any symptoms at all, you need to self-isolate, you need to get tested, you need to be sure that you're not contributing to further transmission of this virus. Today is also the start of Seniors Week, and taking care of our neighbors and those who are older in our communities is incredibly important. We know, and we have said this many times over the last few months, that our elders and seniors are vital to the well-being of our communities. They're the keepers of our history and, in many cases, our culture and language. Let's take the time this week, during BC Seniors Week, to honor our seniors by doing all we can to care for and to protect them. And I want to say thank you as well to the United Way and to the BC Seniors Advocate, Isabel McKenzie, and to the thousands of volunteers and people across this province who have reached out and provided support to vulnerable seniors in the recent weeks, to those people who are in your families, in your communities, or neighbors you may not have known before. Your efforts are making a difference, and we need to continue them. Today is also June 1st, an auspicious day on many other fronts. It marks the restart of a number of additional Phase 2 activities, including this morning our K-12 schools reopened to limited in-class learning, and we've heard many positive things, and I understand about a third of children returned to school this morning in the K-5 age group, and so that's great. Transit is now fully operational, and we know precautions continue to be in place, and provincial parks are now open to camping across the province, open to people from BC. I understand it's been a good day so far, and the school reopening, as you know, was purposefully timed so that we were at the end of our first incubation period, and we've been slowly and cautiously proceeding with our restart. We have been monitoring things closely, and precautions and safety measures are in place in schools around the province, and we are ready for this. I have confidence in knowing that we will continue to monitor carefully and to support our school communities around the province, and public health teams are ready to jump in should we need to. We are all in this together, and as many people return to work, many are also returning to transit, as we know. If you are using transit, we do encourage you to wear a mask. Transit systems are fully operational. There are still limits, and we have worked through with them limits on people who can access or who can be on a bus at any one time. But we know that safe physical distancing may be a challenge during certain times of the day, and that is where a medical mask can help for those short periods of time where you might be within somebody else's safe space. We also know that not everybody can wear a non-medical mask. And for those people, we encourage you to use those non-peak hours where the chances of being within that space of somebody else are lessened. The start of the camping season also means we can expand our time outdoors to include the many nearby and beautiful BC camping locations. But no matter where your summer adventures are be, remember you need to stay home if you're not feeling well, and you need to stay away from others. No exceptions, and that goes across all of our restart programs. And we need to continue to take these precautions that we have been taking that have worked to keep our families and our communities safe. To keep this pandemic of COVID-19 at bay, we need to stay slow, start with a low number of people, that fewer faces and bigger spaces still applies and is more important than ever as we are increasing our connections through going to school, through going back to work, through going out to our parks. A slow and gradual return ensures that we continue to keep our curve flat and that we can continue to respond effectively and protect our loved ones and ourselves. Now more than ever, we need people in BC to be tolerant, to be kind, to be calm, to be safe. In our schools, on our buses, on the streets of our community, and while enjoying everything that we have here in British Columbia.
Thank you very much, Dr. Henry. And I just wanted to start by meeting the challenge for our Different Together pledge to say that our BC is inclusive and respects people of all ethnicities, cultures, and faiths, and their contribution to our collective well-being. Our BC holds diversity as a fundamental value at the heart of the success, strength, and resilience of our communities, workplaces, schools, public and private institutions. I pledge to uphold and promote these values, and I commit to speaking up to oppose racism and hate in all its forms. I want to thank Lieutenant Governor Janet Austin, but also all the tens of thousands of BC British Columbians who've been taking the Different Together pledge over the last few days since it was launched by Her Honor last Friday. I also wanted to join Dr. Henry and on behalf of the Premier and the government in expressing condolences to the one person who passed away over the last 2 days in Fraser Health in long-term care from COVID-19. We know, we continue to hear from people how difficult it is for many people to grieve in these times when we can't gather together in as great a numbers as we would like, as we cannot grieve in the same ways as we're used to grieving. We understand and we hear your sorrow. We feel your sorrow, and we want to provide all the support we can at this difficult time. As noted, there are new cases of COVID-19, in particular, as Dr. Henry has noted, in Fraser Health this weekend. In acute care, we have 16 cases in total, 32 cases in total, which is down 3 from where we were on Saturday. 16 in Fraser Health, 1 in Interior Health, 1 on Vancouver Island, 1 in Northern Health, and 13 in the Vancouver Coastal Health Authority. 5 of those are in critical care. I want to note again that overall utilization of the healthcare system is up at around 70%, just over 50% in critical care right now as we continue to add and introduce new procedures new scheduled surgeries and others to our healthcare system. Again, approximately 5,000 people on the last day, which I believe was Saturday, went to emergency rooms across BC, which is still down from the pre-March average, but significantly up from the low of 2,995 in early April. I wanted to acknowledge as well during the Seniors Week the absolutely critical role, the need, a role that needs to be supported that family caregivers play in supporting seniors across BC. Many family caregivers, of course, are themselves seniors and provide extraordinary support to other seniors. We want to acknowledge their role, thank them for the critical role they play in our society, in our healthcare system, and in every other way. We know how difficult a time particularly it is for those seniors in long-term care at this time, and the need to use virtual means to support people as much as possible, and the difficulty of the restrictions on visitors holds for people in long-term care. As we've seen, there continues to be very significant risk to people in long-term care, and we are not changing at this time those rules on visiting, but we understand the challenge that everyone faces and what a extraordinary additional pressure that places on family caregivers. So we want to acknowledge that in the midst of Seniors Week. And finally, just a few things to say about the events of the weekend, that we want to acknowledge peaceful demonstration against racism in our province, against systemic racism in our province. It's important, the fact that we can join as a community to do that, and the fact that that racism, whether it's here or elsewhere, in the United States, elsewhere in Canada, or here in British Columbia, the anger, the frustration, the fear that it provokes, and the need to respond to that. And so it's important to do that. And of course, the fact that such a demonstration took place and was managed in the way that it was in terms of its expression, in terms of its peaceful nature, is important. However, we do have to know, I do have to know, that physical distancing saves lives, that there's a reason that we have a restriction of 50 people for public gatherings. And that's because there's still considerable risk for COVID-19. And the people most at risk are people who are vulnerable in our society, as Dr. Henry just so eloquently said. So we have to continue to keep that in mind, and that means we have to find new ways, different ways, to protest in our society, to express opposition in our society, to express points of view in our society, and to bring change in our society. And that will require us using, as is happening in every area, new methods to do that, new means to do that. We have to remember, though, that gatherings put many people at risk, and we have to absolutely keep that in mind. Before we go to such a gathering, we have to understand the risks involved for those that we love and care for, and for others in society, and act accordingly. As we start week 3 of phase 2 of our COVID-19 response, it's important to pause and remember what has brought us to this point in our social, surgical, and economic renewal. It's been our collective effort. It has been our collective effort to stop the spread, and our individual commitment to physical distancing that has made the greatest difference. Physical distancing saves lives. While we embrace renewal and the opportunities for new contacts it creates at home, at work, at school, and while out and about in our communities, we must continue to use the skills that Dr. Henry and others in public health have taught us. This means continuing to keep physical distancing as our closest companion for the weeks and months to come. And it means making sure that we support the goal of physical distancing, stopping the spread of COVID-19. It means continuing, of course, to wash our hands and taking extra care in the time of expanding contacts to remember to sneeze and cough into our sleeves, and never, never, never go to work, go to school sick. Staying 100% all in to stop the spread is as important today as it has been every day in our BC COVID-19 effort. No matter how renewal looks for each of us, no matter where we find our own comfort zone, and no matter the difficult issues that continue to demand our action and our commitment, our progress will be faster and our success will be greater if we continue to act with purpose on COVID-19. Stay apart, stay safe, stay 100% all in. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 2 périodes de référence de 24 heures chacune, soit celle de 30 et 31 mai et celle de 31 mai jusqu'au 1er juin en mi-journée. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans la région de santé de Fraser, pour un total de 165 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Pour la première période de référence qui s'étend jusqu'au 31 mai, nous avons eu 9 nouveaux cas. Au cours des dernières 24 heures, 15 nouveaux cas se sont ajoutés. Cela représente 24 nouveaux cas depuis notre dernière mise à jour samedi, pour un total de 2597 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 33 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you. As a reminder to on the phone, please press star 1 to enter the queue. You are limited to 1 question. I would also ask that you please take your phones off mute. You will not be audible until I call your name. First question is from Tanya Fletcher, CBC.
First question is from Tanya Fletcher, CBC.
Oh, hi there. You were both quite vocal off the top talking about the effects we saw at the demonstrations. I'm wondering what you expect that impact might be, say, 2 weeks from now, given the 14-day incubation period. And on that note, it has been 2 weeks since the Phase 2 reopening. So what kind of increase do you expect to see, Dr. Henry, in cases this week?
I'm hoping we won't see an increase in cases this week, but we do know that there continues to be some circulation, particularly in the Lower Mainland, and we have cases that continue to arise, and we're investigating them, whether it's Vancouver Coastal or Fraser Health in particular. We've also had a couple new cases pop up in the North and in Interior Health, so we still need to be vigilant. We still need to be cautious. And, the concerns I have are that it is important for our voices to be heard around these important issues, but in the context that we're in right now, we need to do that in a safe manner. And, people were doing that, and you can do it very effectively. So let's bear that in mind. And where we're making sure our voices are heard, we're doing it in a way that's not going to have impacts on the people that we're closest to. And that's what we've been saying all along. We know that this virus is transmitted between us when we're close. We know that there have been transmissions events, even outside, when people have spent time together and when they're doing things like chanting and yelling or talking closely. So those are risky behaviors right now. And yes, there is a possibility we could see spread from people. Of course, it's all a balancing of risks, and we know that there is still transmission in our community. So it's very important that people monitor themselves, and that when we look at these types of demonstrations, we consider both our risk, who we are around, who's in our family, who's in our bubble, the things that we do. For example, if you're a healthcare worker or you work with vulnerable populations, we need to be aware of that. I am hopeful we will not see an increase in the next couple of weeks, but we know the average incubation period is 5 to 7 days. So people need to be very careful, particularly in the next week.
Next question is from Richard Zussman, Global News.
To that point, Dr. Henry, will there be any orders in place to stop these mass gatherings? And what difference does it make if other groups want to start protests for other causes? Are you concerned that this could lead to a domino effect of these gatherings that are far larger than 50 people?
There is an order in place around mass gatherings, and we have continuously said that 50 people is a maximum. And we know that these types of events can be risky. So I think there are many people out there, and I know there were some leaders in this movement, for example, who respected the fact that this can put people at risk, and it can put people that we are most trying to protect in terms of these demonstrations at risk. I cannot control people's activities. What I can do is provide you with the necessary advice and tools that you need to have a peaceful demonstration in a way that is not going to imperil your family, your loved ones, your community during this time of this pandemic.
I just say that I think it's important in this time, as in all times, that democratic voices are heard, especially against racism and hate in all its forms. But I think what we have to recognize is that we're in a period, really an extended period, where there's going to be a prohibition on mass gatherings. So we have to collectively use our imaginations, and that means on all sides, recognizing the value of other demonstrations, and in the case of for example, people who would cover such things, if I may dare make such a suggestion, recognize virtual gatherings that have a real impact and give them recognition in society and the importance of the voices brought forward, and other means that can be used. A variety, in other words, a gathering of 10 different groups of 50 people as opposed to one group of 500 people, a maximum of 50 people against one group of 500 people. These are the ways in which we can have an impact in society, and I really recommend we look at that. I think there's extraordinary imagination and power in the message brought forward by people, for example, against racism. But it could be any issue. And we've seen other demonstrations over the last couple of weeks as well, and that is what happens in a democracy. But we have to use the tools at our disposal, and right now that means ensuring that we're not putting at risk the most vulnerable people in society, and that's the reason for the public health order. And so let's use our imagination together, and let's recognize different forms of protest as well as we're trying to seek social change.
Next question is from Jeff Andreas, Radio NL.
Hi, thanks for taking my question. So with regards to all the events that we've seen here in recent days, I mean, you had said before, Dr. Henry, that it would take, 3 to 4 weeks after the start of Phase 2 to know if we're ready to move on to Phase 3. A week from now is that minimum 3-week timetable. So I'm just curious, as we see these demonstrations take place, do you have any concern that time frame could in fact get pushed a little bit further on, given that there is that possibility of more outbreaks as a result of these large demonstrations?
Yeah, I mentioned there's a lot of things that sort of started today. We increased transit. We've increased, some children have gone back to in-classroom schooling. These types of demonstrations, these events that have the potential for transmission to large numbers of people, they're all happening around the same time. So yes, we are watching carefully. We're going to be watching, but that is the risk. The risk that we run is that we take is that if we are not continuing to use the tools that we have to prevent transmission, and we know they work, we've shown they work. So if we're not using those tools appropriately, that we are going to give the virus a chance to spread widely again, and that's what we're trying to manage. We want to prevent those outbreaks. We know that there's going to be probably sporadic cases as we've increased our contacts, and we need in public health to be prepared to detect them quickly, to trace the people that they've been in contact with, and to track people through that process of either the incubation period or their illness, so that we can do that safely and prevent the transmission. The challenge that we have had from the very beginning is that once you have been exposed to this virus, there is nothing I can do to prevent you from getting ill if you've been exposed to enough of it. So we can't go back and undo what has happened, so we need to be careful. And, we need to look at ways that we can very effectively have our voices heard, but not endangering. The irony is that we may be endangering the people who are most trying to help with this type of demonstration. So that's what we'll be looking for in the next little while. I'm hopeful that we haven't created too much damage, and that we'll be able to continue to move forward. But we need to be cautious. We need to remember and thoughtful of the sacrifices all of us have made over these past months. And looking forward, that's what we need to keep in our minds.
Alana Kelly, CTV.
Hi, Dr. Henry. Thank you for taking my question. A private school in Duncan is using thermal cameras to temperature check students as they walk through the school. I'd like to know how you feel about this. Do you think it's necessary or efficient? And is this something you think other schools should be doing?
Yeah, so we know, particularly for children, that many of them have very mild symptoms, and it's only about 3/4 of people who have COVID-19 develop a fever. It can be very effective for picking up other things, particularly in adults. So it is not necessary. If that's one of the things that they want to do in that school, that's fine. More important is the health check, making sure that we check in with our children and with ourselves every day before we get on that school bus, before we go into the classroom, before we go into school, to make sure that we are feeling okay. Because there are many other symptoms that can show up as well. So it's not something that I think is necessary or that I would recommend for other schools, but it needs to be put in the context of that all-important health check that all of us must do.
Next question is from Andrew McLeod, the Tyee.
Yeah, hi, Dr. Henry. About a month ago, you talked about the number of excess deaths and how there were more excess deaths than would have been anticipated from COVID-19 alone. At the time, you said you'd have a better idea in June as statistics became available, and I'm wondering what you can tell us now.
Yeah, so I can tell you a couple of things. One is that it is something that we track on an ongoing basis, and we have not seen that excess death continue through the month of April, which tells me again that some of the work that we have collectively been doing to manage this pandemic have been successful. We're still awaiting a lot of the vital stats data. Some of it has not, what we've got so far we've been able to analyze, and when we look at the demographics, it's not the same people that are having the bad outcomes with COVID. So we're still trying to tease apart what exactly is underlying that increase over that period of time in March. I was hoping on Thursday to be able to update that, but I'm not sure it'll be ready. But we will within the next, as soon as we're able to have enough of the data that we can comment on it with some certainty.
Next question is from Stephen Chua, Squamish Chief.
Hi, Doctor. We have had a number of high-profile search and rescue incidents happen in the last week now that the BC parks have opened. And the province has previously advised people to do lower-risk activities that won't involve them getting hurt and hospitalized. We were seeing people rock climbing, mountain biking, kite surfing, hiking, and in some cases requiring rescue. I was just curious to know if you could clarify what is a risky activity that we should be avoiding at this point?
Yeah, as we restart, these types of activities are things that we want to start again. Part of our reason for not wanting people to go into emergency departments or to take those risks particularly during March and early April, was because we have the concern of the increasing numbers of people that we were seeing with COVID and making sure we had the capacity in our health system. It's still always a challenge, and the fact that this virus is still out there means that search and rescue missions are all that more complicated. And we also know that we are in our fire and flood season, and flooding in particular. I know people in the interior are very acutely aware of this. This has been a challenge over the last couple of weeks. So we all need to balance that. But on the other hand, these are activities that people are missing, that they mostly do safely. And now that our parks are opening, they are ones that we can do safely, in that you don't have a lot of physical contact with other people. So, as with always, our message is to be careful, to make sure that you have somebody with you who can assist you, to not take those extra risks, and to try and do things as safely as you possibly can.
Next question is from Nicholas Pesco, Check News.
Yeah, hi. I was wondering if you could talk about COVID-19's impact on minorities in BC and what percentage of minorities have either been infected or died from the virus. Thanks.
Yeah, so as we've talked about before, we have not collected disaggregated data by person's ethnicity or their race or that status. So we don't have that specific data, with the exception of we have been collecting information on indigeneity, whether somebody is First Nations, identifies as First Nations, Métis or Inuit. So we do have that information. The First Nations Health Authority is using that information to support communities. This is why it is so important that we have the survey that we did, because we are collecting that information, and that will give us a broad understanding of not only the impact of the disease, but the impact of the restrictions and the measures that we've put in place across the province and how they differentially impact different communities. And so as soon as that analysis is done, we will be presenting that information. We also are looking at, and I've talked about this before as well, how can we use geographic information to help us understand impacts better. So we it is one of the things that we have not collected that information on all of the cases by race, so we don't have that specific data.
Next question is from Keith Baldry, Global News.
Hi, thanks for this, Dr. Henry, Minister Dix. Just wanted to get your personal sense of where we're at with the reopening. Has it gone in quicker, expanded quicker than you thought, slower? Are we at that 60% interaction level yet, or do we still have more work to get there? And just your own personal experience, have you noticed in where you both live, businesses reopening at a greater clip, and are you taking advantage of them in terms of patronizing them?
Yeah. So I think it's going as I had hoped, which is slowly and thoughtfully. And, I look around, I haven't been traveling very much, so Minister Dix can comment on Vancouver, but, certainly around here in Victoria, people are doing the right thing. They're taking their time, they're making sure they have what they need in place. We're building up confidence slowly, and it's mostly been a very positive thing in what I have seen. And I certainly have tried to experience it myself and support some of, particularly the local restaurants that have been keeping me in takeout for the last few months. And I did have a lovely dinner on the patio on Friday night, so I was really pleased about that. So I think people are doing the right thing. They're doing it in a very thoughtful and measured way. And what I've been seeing, I think it's just the right pace.
I think where I live, certainly where I live in the Joyce Collingwood neighborhood of Vancouver, I think people have done extraordinarily well. They've been very supportive of one another, understanding of one another. So we've seen this in our local parks and everywhere else. I think people understanding the need to physically distance, but also to get outside. And so I don't think in the last few weeks I've ever seen as many people walking outside. And I had the opportunity to do it. And all I can say is that people at least in our neighborhood, have been very thoughtful and very caring to one another. And I just want to thank in particular a young boy who did an impromptu concert for me a couple of weeks ago. As we went by, the family recognized him. We came up to their window and they gave a concert. So I think what we're seeing is, and what we continue to see in Joyce Collingwood, especially in my neighborhood, which I see, a lot of understanding and a lot of caring. Mostly, it should be said, Keith, I've mainly been going to grocery stores and to bakeries and to fruit and vegetable stores so far, but that's actually probably my ordinary consumer pattern, so I don't think there's a lot of change in that. But I think we are seeing an opening up, but a real caution that people are showing. But what impresses me at 7 o'clock when we hear people making noise for healthcare workers and for other frontline workers, and around the rest of the times as well, a real genuine sense of support, mutual respect, and I am impressed in the overall. There's always focus on what happens when things don't happen, but what we're seeing is, I think, a fundamental understanding that we are in a pandemic. And people continue and rightfully understand we're in a pandemic. And I think the generosity they're showing to one another is heartening to me, and I think it should be heartening to everybody.
Sandy Hall, CFAX 107. Oh, sorry.
I've been wearing my non-medical mask in certain occasions, and there's a small grocery store in my neighborhood, and the aisles are quite narrow, so I'm sure that I wear it when I'm in there just to make sure that I'm doing my bit to keep my droplets in as well.
Next question's from Sandy Hall, CFAX 1070.
Oh, you got me all excited there for a sec. I'm wondering, we're hearing about this place at the border, Blaine, Washington, where British Columbians and Americans can come together, and sounds like they haven't been social distancing. There's been hugging and kissing going on, and I'm wondering if you're a little bit worried about these border reunions.
Yeah, I know that there's been a lot of angst for families, a number of families who have been separated from loved ones across the border, and if that is their one contact, then we need to ensure that we're taking the precautions and we're being careful. We are working with the federal government on how we can move ahead some of the reunifications of families and couples and others across the border, and I hope that that will happen in the coming days.
Shannon Waters, BC Today.
Hi, I know we normally get an update on the province's efforts to acquire PPE on Tuesdays, but I'm looking for an update on the PPE pandemic use framework. We'd previously been told that we were at about stage 4, and I'm wondering if the province's efforts to acquire more PPE have downgraded that, and if not, is there any strategy that the province is looking at employing to try and get to the point where we're actually building up a stockpile of PPE in anticipation for a possible second wave?
I mean, the short answer is you're going to get everything tomorrow, but yes, we are still at the same place. Because we've started up surgeries, we want to make sure we continue to have the needed supply in the needed areas on an ongoing basis. But there is absolutely efforts both in BC and across the country there's a whole modeling that's been done across the country and a lot of effort to try and ensure that we have domestic supplies of the critical PPE that we need across the country, and we are very much a part of that. But,
Sure. Just, well, Shannon, tomorrow's our PPE report, so I won't preempt that, but you've seen the reports in recent weeks. For example, with respect to respirators, so we've obtained 4 million respirators, and we're working now to integrate them into the healthcare system. Those are from non-traditional sources of respirators, so we're continuing to make that effort, and I think what you're going to see is a continuing effort in the coming months to build up our resources within the healthcare system so that we're prepared for everything that comes, and that we continue to do that work. So you're quite right that's what we're doing now, and that's what we're going to continue to do in the days and the weeks and the months to come as we prepare for the possibility of future surges of COVID-19 and of the needs of our healthcare system in any event. Regardless of the region and the number of cases, we have seen a significant increase in the run rate. In other words, the utilization of some PPE, and so we've been working together with our healthcare workers to do that, and I think across the system that's going to continue to happen. I think one of the things that's impressive about what's happened in British Columbia, and this is due to the work of Dr. Henry and of officials such as Steve Brown and Peter Pokorny in the Ministry of Health, is the work we've done to integrate all elements of our healthcare system, including long-term care providers, be they private or public, in our system to ensure that people are integrated into our supply chains, and that's got to continue given the risk, especially in long-term care for residents and for healthcare workers.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today with all the information covered. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Nelson Bennett, Business in Vancouver.
Yes, for the provincial parks that are supposed to be open today, I noticed that there's actually quite a few provincial parks that are still completely closed, including Garibaldi Park, which is probably one of the most popular backpacking destinations in this region. The Stein River Valley Park is Heritage Park. It's closed. Tweedsmuir South Park, that's closed. Can you explain why some of these parts, it seems like a lot of them in the Thompson Caribou, are also closed? Can you explain why some of these provincial parks remain closed?
I can tell you what my understanding is, because these are decisions that are being made by people in the parks side of this. So there's basic public health measures that need to be in place, and I know they have concerns about some of the parks where facilities may not yet be available, or that may be not yet ready to support large numbers of people coming. I also know that they have concerns about, as we talked about earlier, about the flood and fire season, and are balancing having people in certain parks and access to certain parks with their ability to have available resources, including search and rescue and other things that are part of that. But I would refer you to Minister Heyman for details on that.
The time we have for today. Thank you.